Hello, my name's Sue. I'm one of the midwives from Antenatal Clinic, and we're going to talk to you about the day of your caesarean section so that you know what to expect when you come for your operation. We will still be asking you to come for a face-to-face visit with us to take some blood so we can check your iron level and hold some blood in the laboratory for you, ready for the operation. We'll also on that day take your weight and give you some tablets to take home with you, which I'm going to explain about in a moment. We'll also be able to answer any questions that you've got when we see you. The summary of what we are going to talk about now will also be given to you on a piece of paper so that you have all of the information actually written down for you. We need to start preparing your tummy at 10 o'clock the night before the operation. So the tablets that we'll give you in the box, they are to reduce the acid in your tummy, and we want you to take one of those at 10 p.m. at night. That's 10 p.m. the night before the operation. After you've swallowed that tablet, the only thing that you can take is water, as much water as you want, through until 7 o'clock in the morning on the day of the operation. At 7 o'clock in the morning, we would like you to take the second tablet that's in the box. It's the same as the first one. After you've swallowed that tablet, please don't drink anything else unless we tell you to. You may be advised by us to take an isotonic drink as well between 6 and 7 on the morning of your caesarean section, but the staff will discuss that with you individually. We'll also tell you when you come where you should go and at what time you should arrive, as this is staggered for ladies arriving throughout the morning. When you come, please just bring one person with you, and that person will be able to stay with you the whole time. We also ask that you just bring a small bag of belongings into the hospital with you, the things that you might need for the first few hours, and that your partner can go back to the car after the baby is born to collect any larger bags and belongings that you might need after that point. Some suggestions are on the information sheet that we'll give you when you come. We also ask that you help us with some preparations and remove as much jewellery as you can. You can wear a ring in theatre if you're unable to remove it, or if it's a wedding band. We will cover it with tape, otherwise all jewellery should be removed. Nails should be free from nail varnish. If you wear contact lenses, we ask that you please bring glasses with you for the operation, and you are unable to wear any metal in your hair on the day of the operation. We'd also prefer it if you didn't wear makeup. When you come, you'll be seen by a midwife who will go through everything with you and will listen to baby's heartbeat and feel your tummy, check the presentation of baby and answer any questions that you've got. You'll also see the doctor who will go through the consent form for you and again discuss the procedure and answer any questions. You'll also see the anaesthetist who will go through pain relief and the spinal anaesthetic with you in more detail and answer your questions. When they're ready for you in theatre, they will give you a gown to wear. Now the gown covers you at the front and does up around the back, and we ask you to remove your underwear at that point. So please bring with you a dressing gown or a long cardigan so that it would go round from the back and cover your back, because occasionally the gowns don't meet at the back. Please also bring some slippers so that you're able to walk down the corridors with something on your feet. Your partner will be given some blue sort of scrubs to wear and a pair of shoes and a hat to put on, and then you will go down to the theatre when they're ready for you. They'll start the procedure by popping a drip into your arm so that we can give you some fluid, and then they will start to do the spinal anaesthetic. That's the anaesthetic that makes you numb for the operation, but where you stay awake. So firstly, they'll get you to curl over forwards across a pillow and get you into the right position. And then they'll ask you to maintain that position. They'll put some local anaesthetic in your back. And then after that, all you will feel is some pushing in your back whilst they find the right space for the spinal. They pop the drugs into the needle. They take the needle then out of your back and nothing else is left in your back normally. They'll pop a plaster on your back and then we'll lie you down. By the time we've done that, you'll be starting to feel the effects of the spinal, which will often start in your toes and spread up towards your tummy. The spinal will make you go numb, and you would normally not be able to wiggle your toe or move your lower legs at all during the operation. It takes away all of the pain of the operation, but it does leave some sensation of touch. So ladies often describe a feeling in their tummy of sort of pushing and pulling during the operation, but not painful. And it's important that you're aware that this sensation may occur, as otherwise sometimes it frightens ladies. When the doctors are very happy that the spinal is working, they will pop a screen up at the level of your chest, and your partner will come round and sit at your sort of right shoulder. They will pop a catheter into your bladder to empty your bladder, but that won't be painful because of the spinal working. And if you haven't done so already, they will also just shave the top off your bikini line, ready for the operation. The doctor will then be ready to start the operation and will make an incision just above your hairline, ready to deliver the baby. They'll work their way down to the uterus, make another incision on the uterus, and then baby will be born and lifted up to show you. We are offering delayed cord clamping to all ladies when the babies are born in a good condition. So the baby will be left attached to the cord for a minute or two in order to allow that blood to go back down the cord to the baby. Then the cord will be cut and the baby will be able to be placed skin to skin on your chest if all is well. The baby would normally be covered with blankets and have a hat popped on to keep it nice and warm. You're able to cuddle the baby then for the remainder of the operation, which would be probably around another half an hour after the birth of the baby. Your wound will normally be stitched with a dissolvable stitch, so it's not normal for anything to need to be removed after the operation, but you'd be advised if this was the case. We pop a sticky dressing across your wound to cover it, and then the operation would be finished. We would then take baby from you and just pass baby to your partner for that moment whilst we slide you off onto a clean bed. The spinal anaesthetic is going to take around 8 hours or so to wear off, so you will be numb for most of this time. When we've popped you onto the bed, we'll pop baby back in with you and wheel you to our recovery area. You'll stay in our recovery area for up to 2 hours, and then if all is well, you will go to the ward after that. During the time in recovery, the only person that can stay with you is your partner. No other visitors are allowed at that point. And we do lots of observations, checking that you're okay, that your spinal's wearing off, that you're not bleeding, that your wound is not oozing. And we get baby to have more skin to skin, get baby to feed, and take it from there and make sure that everything is fine. If at the end of the 2 hours everything is fine, we'll transfer you, your partner and your baby up to the maternity ward. It's quite common procedure for us to put you into a 4-bedded bay at that point, so we can continue to provide close observation of you and keep an eye that everything is okay during the rest of that day. You have a chair beside the bed for your partner to sit in, a cot for the baby, a locker, water and a call bell, and the midwives and maternity care assistants are there to help you with anything that you need. Your partner is able to stay with you 24 hours a day, should you wish, but if they are going home at night time, then you would call the bell and the staff would help you pick up the baby, pass the baby to you and pop the baby back down. We're aiming to take out your catheter around 12 hours post-delivery and to get you water to drink as soon after the operation as we can. Your drip will come down once you're drinking well, and you'll be able to eat whenever you're feeling fine and the staff are happy that you do so. Your baby will wear 2 ankle bracelets while it's with us. These have the alarm tags on them and also match the information on your wristband, so we're able to identify your baby to you. We are concerned about the risk of blood clots in ladies having caesarean sections, so you will be given some knee-high stockings to wear that help the blood go back up your legs, and an injection in your tummy once a day whilst you're with us of an anti-clotting agent to help reduce the risk of blood clots. We also will be advising that you get up and move around as soon as you're able, but for the first time that you get out of bed, please do this with a staff member with you. Going home will be arranged for you as soon as we feel it's suitable. The minimum stay is around 24 hours. Some ladies will stay 2 nights. Some ladies will need to stay longer if their condition or their baby requires it. But everybody is needing to stay the first night after their baby's born. Like I said, your partners can stay with you 24 hours a day if they want to. There is no bed facility for them, but there is the chair beside your bed if they wish to stay. And the ward staff will advise you about the few rules that we ask partners to follow if they are going to stay on the ward with us. Food and drink is provided for you all the time that you're with us. You're very welcome to bring in anything else that you might want, such as snacks or nicer drinks, but actual food and drink is provided. Partners will need to bring their own food with them. Pain relief is done for you by your midwife as and when it's required. So if you do feel that you need more pain relief, please do ask. There is always something extra that can be provided for you. Your midwife on the ward will talk to you about the best time for you to go home and arrange the follow-up with your community midwife for you, and then you'll be ready to go. Thank you for watching. If there's anything that we can answer, please give us a call and we'll give you our numbers. Thank you. Bye-bye.